Sean, when you first went into the hospital with your acute pancreatitis, how did they treat you?
Well, pain medicine, IV. I gained 20 pounds in the hospital from the fluids. And one of the biggest problems I had was, I mentioned I was stricken on December 3rd, 2011. I was in the hospital for 6 days, away from where I lived. I was released, came home, and now we're looking at the Christmas season. And I knew that I wanted to get to a bigger hospital, and was given an appointment on the 28th of December. So, you know, I had kind of a rough go from first being diagnosed with acute pancreatitis until I was able to get in with some specialists for treatment. And it was kind of the way the calendar fell. And so I saw a gastroenterologist who hooked me up with a surgeon within a day or two. And basically the treatment started by the insertion of a feeding tube. I think they call it a jejunostomy. And, but when I presented, I hadn't been eating, I was in a lot of pain, I was dehydrated and malnourished. So I had kind of an uphill battle. And then just before discharge, a couple of days later, my abdomen was continuing to increase, and they realized by CAT scan that I had developed a pseudocyst, and the decision was made to do something. I hadn't heard of this technology, IR, interventional radiology, where they actually inserted a drain up into the pseudocyst, and with the feeding tube and that's where I started to see some relief. So that was the basic approach.
Excellent. Wendy, do you want to talk about how your acute pancreatitis was treated?
Basically, it was just IV hydration, not eating or drinking anything, mostly just just hydration. And then when the pain did subside, they allowed me to have clear liquids. And then after I was able to tolerate the clear liquids, then they started me on solids. And then I was able to go home once I was able to tolerate the solids. I was able to go home.